Hi, my name is Olivia. The purpose of this video is to discuss blood flow restriction training. Now we all know what blood flow restriction training, or BFR, is, and we've done it in the clinic. Today I want to explain in a little more conversation form the physiology behind it and how it actually works at that physiological level. But as I said, I want to have a conversation about this. I am not necessarily going to use all words that perfectly describe what's happening at the cellular level, but I'm here to give a summary that is hopefully a little bit easier to understand, where we really emphasize the importance of working hard and resting hard. Did you ever think about why it is so important to rest when doing blood flow restriction training? Let's take this step by step. Exercise set 1. The patient has put on their bands and they are ready for their exercise. We all know that the normal recommended sets and reps is 3 sets with a 30-second rest break. So we're doing that first set. It's going to be bicep curls. And the patient will be doing about 45 seconds of work or about 30 repetitions. You can think about the blood freely circulating throughout the system because the muscle pump allows circulation to move past the band. Free circulation during exercise set number 1. The first 5 seconds of rest break. The patient just completed their set and the deoxygenated blood is traveling out of the system and the oxygenated blood is replacing that, going into the system. 10 seconds into the rest break, the patient is at rest. And the oxygenated blood then converts itself to deoxygenated blood. After 10 seconds go by, there's going to be a little bit more deoxygenated blood in the system. The band does not allow all of the venous blood to leave the system because veins are more collapsible, and with the nature of the band, that is where there is a quote-unquote pooling of the blood, so there's an increase of deoxygenated blood. 20 seconds into the rest break, there's still a continual exchange from oxygenated blood to deoxygenated blood. But your arm doesn't explode while this happens. There is still a pooling of blood across the band. There is allowed escape of that venous blood into your system. We call it the spilling over the dam. "30 seconds have gone by of rest and your system is nearly full of the deoxygenated blood. This is when you're preparing yourself to hit fatigue. Your system has less oxygen for the moment. Set number 2. The muscular contraction is completed, and because of that muscle pump, all of that venous deoxygenated blood leaves the system, and actually there's a little bit of retrograde movement of the arterial blood. The venous blood has left the system. There's always an equal balance of the circulation and this exchange of circulation. So that force of all that blood coming out actually encourages a huge amount of arterial blood, of oxygenated blood to enter through the system. The oxygenated blood quickly changes to deoxygenated blood because the muscle is working. There's a huge amount of deoxygenated blood that leaves the system, leading to a huge amount of arterial blood that comes into the system. There's actually more oxygenate that is delivered during the contraction phase and during the exercise phase of blood flow restriction training. This is why it's so important to understand that it's not limiting the amount of blood that's in your system, it's manipulating the oxygen that's within your limb. Rest break number 2. Exercise is complete and the blood goes where it wants. It is entering the limb, there's a combination of oxygenated blood and deoxygenated blood. After 10 seconds, without having that muscular contraction, there is an increase of deoxygenated blood. There's a little bit of pooling over the dam after 20 seconds. All of this encourages distension of your veins, which increases things like VEGF, and which improves your circulatory health and your vascular health. After 30 seconds, there's even more of that deoxygenated blood in the system, and this is when metabolic crisis occurs. There is a decrease of oxygen. There is an increase of lactate. There is a decrease of the pH level. All of these contribute to the metabolic crisis. We're on to exercise set number 3. The muscle contraction occurs. Venous and arterial blood goes through the system and across the band. Because there is always a balance of the venous and arterial flow, there's an exchange. There is a huge amount of arterial blood that flows into the system. There is some fear when talk of blood flow restriction about, oh, I don't want to decrease the amount of oxygen or the amount of blood to healing tissues. Blood flow restriction in general is bringing about temporary hypoxia, but note it's only temporary. There are moments where there is a huge increase and exchange of that blood, and it is not stasis of the blood. Another muscular contraction occurs. It's so important to not only rest hard, as I've explained, but to work hard so that there is enough exchange of the blood and a strong enough muscle pump to truly exhaust your system. If you are doing simple exercises that clearly do not fatigue a person, you're not going to get those signs which are so important, like a change of coloration in the limb, vein distension, increase in heart rate, increase in respiratory rate. All of these things need to be present in order to see that blood flow restriction is going to work and it's worthwhile for that patient. Work hard, rest hard. Work hard. You want to make sure that you effectively use up the ATP in your system. Deplete your system of ATP so that you can get past the first fatigable motor units, go to the second motor units, and the final level of motor units so that you can create a cascade of failure to the system where all of the motor units are depleted. And then also, rest hard. You want to stall the delivery of oxygen to the working tissues so that metabolic crisis can occur. We talked about how the decrease of oxygen to the system, the increase in lactate, the hypoxic state, the decrease in pH levels, all of those things help stimulate the increase of growth hormone through your system and upregulate protein synthesis. So the next time you work with your patient and lead them through blood flow restriction training, ask yourself, is this patient working hard enough to deplete their system of oxygen? Are they working hard enough to deplete their system of ATP? Then ask yourself, are they resting hard enough to allow the metabolic crisis to occur? It's that pause in the circulation that creates the hypoxic state, which makes blood flow restriction therapy work.